one of the articles that Skilled Nursing News recently published called The Trends That Will Shape Skilled Nursing in 2022. They said, whenever I've asked operators what they think the solution is to the staffing problem, there's never just one. There's no silver bullet. The author goes on to say it will take coordination and collaboration from the facilities themselves. Talk about, during these challenging times, how they've affected your staff turnover.
Oh, I mean, it's been a huge challenge. I mean, that's the focus of our building, trying to keep our staff, keep them happy, keep them engaged on top of the more busyness of your schedule. So we're getting more regulations, more things we have to turn into the government, and they're doing the best they can to try and, fight against COVID. That's been the big topic for the last couple of years. But that's creating more regulations. So it takes my time away from my staff into taking care of the regulations. But then also you're having problems with your staffing and they're leaving and trying to keep the morale up and telling them that they're doing a good fight. I mean, it's tremendous weight and pressure, and you could literally live there 24/7 and not get it all done.
So you've got increased regulation, and that's really difficult because now you've got extra paperwork. So that's more stress on you, and I would imagine a few other key people in your facility, right?
You're exactly right. And it's taken time away. It takes an hour or two to make sure, and if you mess up anything, then you're going to get a fine or there's pretty big consequences from that. And so you want to make sure you get your reports done on time and 100% accurate. So it's not something you can just kind of mow over and just kind of quick and get it over there, get the gist of it. It has to be perfect. And so that puts a lot of added stress. And then you have the staffing and on top of that. And it just creates an everyday just, I hope I can make it through the day.
Yeah. It's a very reactive business, isn't it?
Oh, for sure.
I mean, you're reacting to patients and their needs. You're reacting to orders and updates from a doctor. You're reacting to maybe a staffing shortage. And now you're reacting to new paperwork. Talk about how this reactivity is affecting your staff.
Oh, the morale is down. It's just frustrating from everybody's point of view when you can't really do all the things that are required of you and to do it 100%. Yeah. For me, I've always wanted to excel and be the best at what I do. And so it's hard where you have to almost pick and choose what areas you're going to be good at and what areas you're just not going to be as well at.
There's only so many things you can do in a day, right?
Exactly.
Now, turnover is one major cost that most businesses don't track the cost of, right? They know that they're going to lose some people. They know that they have to put some money into hiring. But far too often, businesses don't track the cost of that. Talk about how turnover has affected your business from a financial standpoint.
Well, I'm fortunate, and I feel, I've been doing this for a long time, that I've been able to hedge this off a little bit. But that I feel bad for new administrators that don't know about that, because you kind of learn the hard knocks where all of a sudden you're letting people go, and then they come back and you're like, oh my gosh, my bottom line just shrank to nothing.
Because
because
of
the
cost,
turnover,
right?
And how much it almost doubles and triples your bottom line of the cost for, just your bottom line just shrinks and goes away.
Yeah, I think I read something recently where they said that the role of an administrator, most people stay in an administrator role between 1 to 3 years.
Yeah.
And so, like you're talking about, you're a unicorn out there. You've been in this role for 18 years.
Yeah.
People that are within that 1 to 3 year timeline, they haven't learned how to reduce this turnover.
No, you're exactly right. And that's where I feel like I kind of had a little bit of an advantage. I feel bad for new administrators coming on board, because you got to learn all the things I've learned and kind of went through when the pressure wasn't on.
Right.
And now there's all this added pressure, all this added, complexity to healthcare. There's just no way you can be, I feel bad, really successful in a really good way in every category. It's impossible.